Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. Ava Neal was diagnosed with not one, but two cancers at the height of the COVID pandemic, putting her in a uniquely vulnerable position. Plus, she continued to work while also raising her 2-year-old grandson. And it's safe to say she had a lot to juggle while facing her double diagnosis. But we are so glad to have Ava joining us here in studio with us today to share where she found the strength to endure both breast and ovarian cancer at the same time during this pandemic. A lot going on, Ava, and we're going to talk more about that. We also have Dr. Lori Spuzak. Always great to have her. She is Ava's gynecologic oncologist. She is also a palliative care doctor here at the University of Kansas Health System in the Cancer Center. Always good to have you here at the desk.
Happy to be here.
You're always interesting to have on, and you have so much to share. So, Ava, let's go back to March 2020. When we all hear the words March 2020, it's like, oh, we all know what we were all doing and what we were thinking. The world shut down due to this pandemic. But it's also the month that you noticed a lump, and it wasn't in your breast or your armpit. Where
Correct.
was it?
I noticed a lump in my abdomen, and it was very small in the beginning. I let time pass a little, and it began to get a little larger. So right off, I didn't think, oh, I've got ovarian cancer. I thought it was either constipation or maybe a hernia.
Because we have a lot going on in the gut,
That's
Dr.
right.
Spuzak.
That's right.
I don't know if I would jump to, ovarian cancer. You'd just think something else was up down there.
Common things are common, right? Many women say, well, after pregnancy, like a lot of them don't go back to their GYNs because nothing's going on down there, right? And so many times the first thing that people think of is GI. Yeah.
GI, because it sounds like we all have some sort of GI issue
right.
going on to some level. But any pain at that lump site, Ava?
I did not have any pain, no symptoms other than that I could find than the lump. And my sister and mother had had hernias, so I laid down and I had my sister feel it. She's like, no, that's not a hernia. You need to go to the doctor.
Oh, good thinking, having somebody else get in there and see what's going on. But you did go to your OBGYN.
Yes, at that point then I did.
And what did they say? What did they do?
I was referred to have a sonogram at the Kansas University Cancer Center.
So tell us how long it had been since your last mammogram.
Well, that I didn't have my mammogram as doctors recommended. I hadn't had one yet. So when I did have my sonogram, I believe there was some suspicion in the breast area. So I was also recommended to have a mammogram around the same time as my sonogram.
So you're checking on this lump down here, and that's when they recommended to go have the mammogram.
Yes.
Just to kind of get the chronological
order.
order.
I'll just shout out to Dr. Norwald, who's also a KU provider, that the first and most important thing that you did was go and see a doctor, okay? And then that doctor did an amazing head-to-toe exam. So she did a pelvic exam, she did a breast exam, and she felt not only the pelvic mass, but also breast mass, and then she sent you for the appropriate workup and testing. And so you went for your ultrasound, and she also scheduled you for a mammogram. And so the most important thing that you did was see your doctor.
Well, I wanted her to know that too, because I asked you, had you been, and you said, no, I hadn't had a mammogram. I was like, no, back up. You went to your doctor when you thought that there was something going on.
Yeah.
That is really good news.
It's critical. It's critical.
You did the right thing.
And that you referred to an OBGYN, because many times a lot of folks kind of stay in primary care, and then actually, unfortunately, a lot of times ovarian cancer can be overlooked and sort of bypassed for a GI complaint or a concern. Right. And so lucky, you went to see an OBGYN.
Yes, exactly. And then you did go get that mammogram. And we're kind of bouncing around. Again, it's Ovarian Cancer Awareness Month, but we're talking breast because you had both at the same time, if you're just joining us. But ovarian cancer, gosh, it's tricky. The symptoms and signs. Let's go over those because they're hard to catch.
Sure. And so actually the most common findings are GI issues. And so bloating, sometimes pain, but mostly like changes in your bowel or bladder habits, fullness feeling, aching. So these are the kinds of things that people feel, and so you can see why it would be mistaken for other things. In your case, you actually felt a mass. And so these are the things that we can see when someone starts having a tumor growing, which is, in your case, what was found.
Is that typical, though, to be able to feel it? If, you know, we tell women if you feel a suspicious lump in your breast,
it's pretty common. So every week I see many women coming in for large pelvic masses, and we can't know just by looking at it on imaging if it's cancer or not. And so then we have to make a decision about what we're going to do next. And so this is something that comes up not infrequently, is what are the next steps for how we manage it? So if it looks like on your CAT scan, it's something that we can manage safely surgically, meaning that we don't see that cancer has spread throughout the rest of the body. It looks like we can remove the cancer safely, then we'll go for surgery first, which is actually what we did in your case. Yeah.
So CT, sonogram.
A CT scan looking at the whole body. If it feels like something is limited to the pelvis, many times a GYN diagnosis starts with an ultrasound, a transvaginal ultrasound or a lower pelvic ultrasound to look at the uterus, tubes, and ovaries. But then if something looks suspicious, it'll expand to a CAT scan looking at the whole body.
So educate me and everyone else who doesn't know what a CA-125 is.
Oh, sure.
What is the role of that, and what is it?
So CA-125 is a cancer tumor marker, and it can be elevated for benign conditions. And so we have to be careful about how we use it, but we do know that it can be elevated significantly in ovarian cancer. Other things that are not ovarian cancer can elevate it, like really bad fibroids or endometriosis, sometimes liver disease. So we have to use that tumor marker with other findings on imaging and exam to help us interpret what that means, what the significance of it is. And then if it's elevated, it's something that we can follow as we're giving treatment to see how someone responds to that treatment, and also if the cancer is coming back too. So we follow that with exam as well.
A common question is often with any cancers, what stage is it? Tell us about the stages of ovarian cancer. What do they mean, and where was Ava?
Sure, and so stages of any cancer, usually the way we think about it is when it starts first in that organ. So if it stays in that organ, it's usually stage 1. Okay. If it starts spreading to something local, it's probably stage 2. If it spreads more remotely, then it's stage 3. And then if it's widely metastatic, usually, and that means really spread to other major organs, then that's usually stage 4. So in your case, you were stage 3. Yeah. Yeah.
Like with breast cancer, where there's many types.
Yeah.
Is that the same for ovarian cancer? Different
yes,
types?
There are many types of ovarian cancer, and because of that, not one treatment fits all. So there's many different treatments depending on what cell type comes back from surgery or from biopsy.
Ava, this is a lot of information coming at you all at once, and you're also dealing with breast cancer at the same time. So how were you handling all this? What questions were you having as you were kind of starting to lay out the treatment path for both?
For questions for my doctor?
Yeah.
Just the whole gamut. I mean, what do I start with? Why am I treating one before or can they both be treated at the same time? I was told that the breast cancer could benefit from the chemotherapy, even though the chemotherapy was for my ovarian cancer. It could shrink my breast tumor also, which it did, but not enough that I could avoid having the complete mastectomy of the left breast. But
yeah, Dr. Spuzak, how common or rare is it for somebody to be going through 2 cancers at one time?
It's pretty rare, but I would say I have a handful of patients every year that have a dual diagnosis, like 2 different cancers going on at the same time. And then what we have to do is negotiate which one do we think is more life-threatening, and we start with that treatment first, and then we hope that also that treatment impacts the other cancer. Like for you, it allowed us to have benefit, and we're lucky in some ways with breast and ovarian cancer, uterine cancer. There's overlapping pathways that are being treated with estrogen receptors and things like that, and so many times, many of the same drugs are used in different ways for the 2 different cancers. So we're also lucky in that way. Yeah.
So this is all happening at a very uncertain time. A lot of precautions need to be taken anyway for a healthy person, and then you're trying to protect yourself going through cancer treatment, and you have a young child at home. How are you managing all of that?
I basically masked up. I followed all the CDC guidelines. I avoided large gatherings, so that meant not a big family Thanksgiving, not a big family Christmas get together. Everything was small, and I only went out when I needed to, basically to get groceries. My work did shut down for a short time, and I basically stayed home and safe during that time. I masked up whenever I came in for appointments at the hospital.
Sure, necessary appointments at that time. So were you quarantining before, leading up to your hysterectomy?
Not for the most part, just basically doing the CDC guidelines, my mask and avoiding, I mean, I wore it at work all the time at my desk. Even when I was alone, I had the mask on. Yeah. I just followed the guidelines.
You know, it's really interesting. We actually did a study where we interviewed women who were going through cancer treatment during COVID. And interestingly, actually, a lot of the precautions that people had to take during COVID were things that they might have been doing anyway.
Right.
And in fact, a lot of folks actually felt safer during the COVID pandemic because of the strict restrictions for masking and things like that than folks who are going through treatment now, where many people, if they're sick, don't actually mask around their friends or family.
People are required to be safe around you now.
And so actually for some women it was actually liberating in some ways because you didn't have to ask people to behave in a kind and courteous way while you were going through treatment.
Right. Everyone was on board.
Everyone was on board, yeah.
So I want to talk a little bit about, because when we talk about 2 diagnoses at once, you're talking about our ovarian cancer doctors, and then you've got your breast cancer doctors, and how you all are communicating. But the plan was to have this hysterectomy first, then the chemo, then the mastectomy, then radiation. What is the collaboration? What are those conversations going on between 2 different teams that handle 2 different parts of the body?
Yeah, that's a great question. And so whenever we're doing treatment planning doesn't usually happen in a vacuum. It's not just me. First of all, we have things called tumor conferences or tumor boards where everyone in the oncology service, pathologists, radiologists who are specialized in your tumor actually come together to discuss treatments and make a plan together. So that happens in GYN, and then it happens in breast, and then the 2 oncologists will talk and make a plan together. And there's a lot of things that go into treatment decision making. It's not just about the cancer itself, it's also how is someone's physical function. How is that impacting their quality of life? Like, for example, if we chose to treat the breast first, well, would that mass have gotten so big that you wouldn't be able to eat, drink, move around, feel pain all the time? So you have to think about weighing all of those things together, how to prioritize treatment. Yeah.
And speaking of priorities, you have a small child at home. You are helping to care for your 2-year-old grandson. Were you able to see him while you were recovering and in the hospital? Were you able to have visitors at a time during COVID?
For the ovarian cancer, I was able to have a visitor, my little sister. It was a very long surgery, so basically she waited all day long, and I was able to see her that night, but I was probably in no shape to have a visitor. So she checked on me, made sure I was okay, and then went on. But yes, she also helped take care of my grandson for the, 2 or 3 weeks that it took to really recover enough to where I could be comfortable. But
I can't imagine
I was
going through everything all at once. I have so much respect for you.
Thank you.
For how much work you did, not only for yourself, but for your family while you were going through treatment. It's absolutely unbelievable what you did. So
thank you.
I had to do it.
Yeah. You said it, because I'm just sitting there as just thinking back when I had a 2-year-old. I mean, at my healthiest, it's exhausting, and then you're dealing with a pandemic, double cancer diagnosis, and a small child. So yes,
it's absolutely unbelievable, and I definitely admire everything that you've done.
Thank you.
Yeah.
And I did it all. I basically was telling myself I have to do this for this little guy. I mean, he needs me, so
Right.
I did it.
He needs you well.
And you did. Yeah.
Yes.
And
Which
here
is
you are.
Amazing. And
Yes.
here you are. Yeah.
Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email the Medical News Network. The information is right there on your screen. So, Dr. Spuzak, was there a connection between the ovarian cancer and the breast cancer?
This is like, for me, the biggest crazy situation that happened. You know, we sent you for genetic testing and your genetic testing was negative, right? When there's cases like this where someone has a concurrent diagnosis and their genetic testing is negative, I'm always shocked. And frankly, in my heart of hearts, I think we just don't know enough yet. Like we're at the infancy of knowing all of the possible genetic connections for disease. But as far as we know, you did not have a genetic connection between your breast and ovarian cancer. But most typically, when people do have these types of dual diagnosis, there is something going on in their family.
Okay,
Yeah.
but
Yeah.
is the fact that she had one cancer at the same time as another cancer, that's a connection?
Well, so
yeah.
right. Well, so your genetic testing was negative, but we do know that once somebody has a cancer, they're at higher risk of other cancers. And whether or not we have a gene that attributes the risk for that, sometimes we don't. Sometimes we don't come up with one. But we do know that there is a risk. And so I say to all of my patients that for sure, if you've had a cancer, you should stay up to date with whatever screening for other cancers you can have access to, because we just see it in big database studies that once you've had one cancer, you're at risk for others. Yeah.
What was chemo like for you? What was that experience like? Did you have side effects?
The worst side effect for me was I lost my hair. I was never nauseous. I wasn't exhausted. I was prepared to feel all those things because that's what I heard happens when you go through chemo. I was fortunate. I did not have any of that, just the loss of hair. And I even went to work. The days I missed were just the chemo days. I'd go back the next day.
Good for you. So what was it like talking with your grandson about this? What were those conversations like? Because somebody's out there maybe needing to know, how am I going to approach my kids? What was,
Since
how'd you
he
begin?
was 2 going on 3, there wasn't too much. I didn't want to sit him down and, this is the definition of cancer. I just kind of told him grandma's sick, but I'm going to get better. And that was basically it. He's ready to go back and outside and play.
Yeah.
I didn't linger on it. I stiff upper lip and just keep doing everything I did with him. I didn't really change much of anything. I kept my routines and I just told him grandma's going to get better.
And these smiling faces, these pictures, it's like what you said, I have to keep going for this little guy. He needs me.
Yes.
Yes.
And that's one of the main drivers and what I think that helped me get through the entire process.
We want to share 2 photographs that we have right here. Oh, the old bell ringing.
The bell ringing.
It's a great sound. You did it twice, marking the end of your chemo and then the end of your radiation treatment.
Correct.
What was that like?
The first one was, I was just happy to be rid of the chemo, getting up, going in all day, having chemo, the whole process of that. I was happy to ring the bell and be done with the chemotherapy. The second one, the ringing of the bell for the radiation, I believe that is the first time I heard someone say congratulations. They either said you're cancer-free or congratulations for being a survivor. And that just hit home. I was just like, yes.
Yeah.
That one. So that was very substantial bell ringing that time.
It's emotional.
It
Yes.
takes so much work to go through treatment. I think folks who aren't walking in your journey underestimate how much work there is every single day that you go through to get through the process of treatment. And so to honor that, it's there. Yeah. So there's not a ton of things that we can do to honor that. So I'm so glad that you felt like that was a moment, at least, that you had to honor how much work.
Yes.
Yeah.
And I know, Dr. Spuzak, being here with Ava, seeing those photographs, it's kind of what gets you up in the morning.
Absolutely, 100% agreed. I am so proud of you and everything that you've done.
Thank you so much.
I love my patients, and really,
and I appreciate you and all that you did.
And
I mean,
so, for
you
sure,
didn't get the time off that we did for COVID. You had to keep going.
That's true, I guess. Yeah,
Yeah.
that's true. Yeah.
Personal life's doing pretty good too, Ava, I hear.
Yes.
Do share. I want to be nosy. I want to know all about it.
Yes. I met my boyfriend Greg a couple, I believe it was 2 months after I finished my last radiation treatment. And we've been together since and going good.
And interesting, you know, you were living life so regularly as you could that he didn't even, he had no idea that what you had just come out of. He had no idea that you had just finished radiation treatment or something. Is that what I understand?
Well, I wanted to be very open that I was a cancer survivor, so he knew that. He just didn't know that 2 months before our first date, I had finished my last radiation treatment.
How important has his support been during this time?
Very. He's listens to my stories, listens to my history of it, never tires of it, doesn't, you know, he's a good listener. He's taken me to some appointments. He's just great.
He's there.
I love that.
Why has it been so important for you to just share your story, be an example to others who maybe are going through it, who might be going through it and don't know what's coming? You know, what's your message to them?
You can get through it. I had to compartmentalize, but I had, you know, my grandson. I just focused on something, and I'm just kept telling myself, well, I'm going to get through this. I'm going to get through this, and I just feel like if I can help one person, you know, listen to their doctors and get their screenings done, I've helped one person,
well,
and
that's why you're here today.
Body, which is what you do.
Yes.
Yeah.
Right.
Yeah.
And that's all we can do.
Ava's on maintenance medication. What does it mean to be kind of in that phase?
Right. So actually, when I started working at KU, this didn't exist yet. And in fact, we did a study while we participated in a large international study about these drugs called PARP inhibitors that basically target certain. It's called homologous recombination deficiency. It's a hallmark of ovarian cancers, even if you don't have a BRCA mutation. And these drugs basically promote progression-free survival, which means longer life, basically for patients, longer disease-free intervals. And so we did these studies while I've been here, and then they were approved by the time you were finished your treatment, and so we were able to start one of these drugs. And so you were on one of the PARP inhibitor drugs, and you were on it for, I believe, 3 years,
yes.
right? And so anyway, you're a success story of how those work.
And off the medications now?
I'm off of the PARP inhibitor. I do take an estrogen blocker.
And what does that mean, though, to be off a certain medication?
Well, it means that she's derived the full benefit of those drugs, and we're in full surveillance. And what I tell folks over time is, like, at each interval, how you do depends, or like impacts the rest of your life. Like, so at each time, how you responded to chemo, how your surgery went, were we able to remove all the visible tumor, how you're doing with that chemo after surgery. Are you able to achieve a remission at all of those different times, meaning no cancer? And then how you do with the PARP inhibitor. Does the cancer stay away? And it did. And then, so all of these are signals of long life, and all we can do is have deep hope and faith that you will stay cancer-free.
On that note, and with all the research that you've been involved in, what's promising to you? What excites you that's coming down the pipeline?
You know, there are so many different studies that we're doing here at KU. I want to also shout out to Dr. Annie Jewell, who is a tremendous force at KU for promoting clinical trials in gynecologic oncology, both for clinical trials in the clinic setting, but also in something called phase 1, which is first-in-human trials. She's been doing that since she joined KU in 2015, and that is really unusual. We're so lucky to have her here, and so we get access to so many different new technologies and get to be part of these tremendous clinical trials that are truly practice-changing, and then folks derive benefits from them. And so we're really lucky to be here at KU because we're not just an NCI designated comprehensive cancer center, but in gynecologic oncology, we have things that are unmatched at many other cancer centers around the country. So it's a tremendous time to get care here, yeah.
Let's get to some questions from our viewers this morning. Jean wants to know, back to that CA-125 that I had not heard of, Jean wants to know, is that tumor biomarker in the blood?
It is in the blood, yes, and so it's something that's tested for by a blood test.
Jeremy wants to know, he says, I've heard that ovarian cancer can look like IBS or a UTI at first. Is that true? And if so, how do you know when to start asking more questions of your doctor?
So that's a great question. So many times the signs or symptoms of ovarian cancer can be like what we described earlier, those sort of vague bloating, vague pain type symptoms. When things don't go away, so you've had a symptom, you've tried a simple treatment for it, doesn't go away, you really need to start demanding further care, either referral to GYN, further expanded imaging to see what's going on if you're being managed by a primary care provider. So,
touch on this again. Yen Ling wants to know, I'd like to ask whether breast cancer, colorectal cancer, endometrial cancer, or ovarian share a common genetic profile. In other words, if a woman is diagnosed with one of these 4 types of cancers, would she also need to be taking those precautions because of developing others?
That's a great question. There are many different gene families that can put you at risk for different pathways. Something like Lynch syndrome can put you at risk of ovarian cancer, colon cancer, and endometrial cancer, whereas a BRCA pathway would put you at risk for ovarian cancer and breast cancer predominantly, but then there's also other cancers related to it, like pancreatic cancer for BRCA type 2 or prostate cancer. So it depends on what genetic pathway you have been tested for and you might be on with you and your family in the genes that you're born with, and that's called germline genetic testing, that tells you what cancers you're at risk for. Yeah.
Ava is asking, how much time passed from the start of your diagnosis to that bell ringing, your last radiation treatment?
That would have been a little over a year. So I went through 2 surgeries, 2 treatments, and follow up, and just a little over a year. And that, to me, in my opinion, that is amazingly fast.
Well, what do you want the big takeaway from your story to be?
I would say follow the doctor recommended guidelines for getting your health screenings. If I had gotten mine at 40, I may have gotten my breast cancer at an earlier stage. So yeah, definitely see your doctor, especially if you have symptoms, but even if you have no symptoms, it's possible you have the disease, so you should get your screenings done at the appropriate age.
Thank you for sharing your story, being with us today.
Thank you for having me.
Take care of that little guy.
Yes.
Dr. Spuzak, what's the big takeaway?
You know, for me, this is an election year, and so I think it's really important to think about, is the person that you're voting for supporting research into cancer? Are they supporting health coverage for folks who have cancer? For example, protections against pre-existing conditions. Are they supporting expanded coverage for health benefits like medications like a PARP inhibitor that you have to otherwise pay for out of pocket that costs thousands and thousands of dollars. So it's really important to get out to vote and also to really think about who you're voting for and how it impacts someone like Ava, how it impacts my ability to practice healthcare. And so it's really important to think about that this year.
I knew you'd swerve over into the other lane. Even if I tried to stop you, I knew that was happening. Always good to have you.
Yeah.
Be well. Thank you for being with us today.
much.
Thanks to all of our viewers for your questions. Have a great weekend. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update, Bree Morgan barely survived after delivering her baby boy. The fight to save her life claimed both her arms, both her legs, but not her spirit. I'm Jessica Lovell on the next Morning Medical Update. The double diagnosis that made Bree's case so tough to treat and kept her hospitalized for months. How she's adapting to motherhood as a quadruple amputee. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.